Paris 2022. We have the honor to have with us today Adnan Siddiqui. And I understand that you're working on some of the new technologies that people can expect in the next few years. You want to tell us a little about that?
Yes, I think the field of neurointervention is starting to move beyond the confines of standard plumbing, which is what we have done since time immemorial. If it's a source of hemorrhage, we plug it, and if it's a source of blockage, we open it. That's been the essence of the field. But we are now starting to go beyond standard plumbing to now a variety of new interventions which previously were not considered possible. So there's the example of managing intracranial hypertension through venous stenting for pseudotumor cerebri. There are some trials which have been completed. I think it's going to change the way we treat pseudotumor cerebri with venous stenting in the sinus. There's also the E-shunt, which is a management of hydrocephalus through a transvenous approach, where you put a one-way valve into the cerebellopontine angle cistern, where CSF can be dripped through a single one-way valve into the jugular vein. I think that's quite phenomenal. And then the most exciting personally to me is the possibility of a brain-machine interface through a transvenous route, such as Synchron is starting to do with people who have severe paralysis, to be able to interpret signals in the cortex and then mechanize implements, eventually potentially exoskeleton. But I think that is the next phase of evolution in our field, where we now start to utilize vascular access to affect brain function.
So you've developed the skills to be able to go into these arteries and veins, but now it's the devices or your understanding of the anatomy or just the brain itself that allows you to develop these further
Yes,
machines?
so we started off with primarily arterial interventions. So you would go through the artery to coil an aneurysm or put in a stent or a flow diverter or open it. But then we started doing procedures through veins. And there is transvenous embolization of arteriovenous malformations. And as we have done more and more procedures through veins, we realized that getting access to the brain is a lot simpler, faster, and potentially more effective through a venous route than through an arterial route, because the risk of an embolic complication does not exist on the venous side. Veins tend to be much larger and in greater proximity to key areas of the brain. So you can get through the venous system into much deeper areas of the brain much more effectively. And so we are starting to harness those tools to get into the brain for functionality.
In a sense, allowing you to mine the information that's in the deep brain.
Absolutely. So one of the issues, for instance, with brain-machine interface has been that when people try to put stimulators directly on the surface of the brain, they tend to get encapsulated by fibrotic responses, which diminish the ability to signal transduct through the brain. When you go through a venous system, it gets endothelialized, and the signal transduction does not decline. And so that becomes a much more effective means to be able to interpret information derived from the brain and then affect an action that interacts reciprocally.
In the two directions.
In the two directions.
So that's incredible. So the future then is in the development of, I imagine, devices and also your understanding on what the devices bring to you.
Absolutely. So you can think of sensors that can interact with the brain by recording electrical activity in the brain, interpret that activity, and then interdict and change the functionality of the brain.
Well, thank you very much. So this is the next phase of interventional neuroradiology.
I believe that certainly is.
Thank you very much.